Good morning, everyone.
Good morning, sir.
So, from almost next week onwards, everyone can listen my voice. Last you, okay. So, all of you can listen. Okay. So, from next week onwards, probably we are going to start with the dissection proper part with the cadaver and all, and there are certain precautions that you can maintain. So, it might be difficult for you to have the first 1 or 2 weeks class, because from cadavers we usually preserve them using formalin, and that formalin is like feels like a burning sensation in our eyes. Okay, and there is a different type of smell which could be obnoxious for the first time. Okay, so for that thing you can use some glass, or you can avoid the glass, but you can have some watering in the eyes. So there are these are certain precautions, so you can carry hanky with you. Okay, and for the smelling part you should have one mask. Okay, so with a mask that will be good for you, and after 1 or 2 weeks you will be habituated with the dissection classes. Okay, so these are certain precautions. Now what to expect from a dissection class? So basically we will be telling you about the theory part, that what you are going to see. That thing will be a revision of your lecture class, because in lecture also you will be studying those topics only, and we will give you a brief review about those topics in our dissection class also. And then we will tell you where to find those structures, and we will cut and show you those structures, and you will also by yourself will if possible will cut 1 or 2 structures and show to us. Those structures will be given to you in your exam. Okay, so throughout the year we will divide the whole year into different segment wise. So for first semester, suppose we are planning to have upper limb and thorax. Then in second semester we are planning to have our lower limb and abdomen, and in our third semester we are planning to have head and neck and neuroanatomy part. So what to expect from these parts? Now in upper limb and thorax we will be showing you all the muscles. Definitely in all the dissection part we will be showing you certain structures. First of all, there will be muscles. Nothing to write here. You will be seeing those structures at that time, you will get it yourself. I am just giving you a orientation of what to expect in a dissection class, so that whenever a topic is given, you come prepared that these things I should know before going to the dissection class, or else you cannot understand the things. Now, first of all, there will be muscles, then there will be your blood supply. Of these muscles. Then there will be nerve supply. Of these muscles. Now, before that, whenever studying a specific compartment, we usually study the different layers. Okay. If you feel suffocated, you can make spaces among yourself. That will be fine. If you feel suffocated, or else it's fine. So, so there will be muscles and their blood supply and nerve supply, and we will also learn about how to approach those muscles. So there are certain criteria of dissecting a structure. We cannot just be a butcher and cut them. Okay. So now there are certain criteria through which we make an incision. So anyone can tell me what is this structure? It is an instrument. What is this? No. That is a part of a scalpel. What is this? This is our BP handle. So here BP means there is a long form, I forgot, barred Parker needle handle like this. Okay, just check it once. So we call it in short BP handle. And in front we attach the blade. like this. So this is the basic instrument through which we start our dissection. Now only with a scalpel we will be cutting, but without this also we need to hold the muscles. So for holding the muscles there are certain other instruments. Yes. So this is a forceps. Forceps are also of two types. One is your toothed forceps. Okay, it will be having teeth in front. What is the purpose? The purpose is to grab the muscle. Okay, the purpose of a toothed forceps will be to grab the muscle. Then there will be a blunt forceps. So as the name suggests, it will not be having any tooth. Those blunt forceps will be to hold a tubular structure. Okay, suppose I am holding a artery. Now to hold the artery, I have to grab it in such a way that the artery doesn't get punctured. So if I use the toothed forceps, it will be having teeth, sharp pointed structure in the front, so it will be easily punctured. So I will use a blunt forceps. Similarly, there are other instruments which we generally don't need, such as mosquito forceps. So mosquito forceps is basically a scissor. Okay, the name is forceps, but it is a scissor. So mosquito forceps we usually use. So with that we cut small cutaneous structure. Okay. Now these are the instruments. No need to write these things. Okay, these are like you will be understanding this within 1 week also, and nobody will be asking this question, at least in anatomy. These are instruments basically for your surgery part. So in surgery you will be getting questions from this, but not in anatomy. Let me show you. So as I have already told you, to touch the structure you should always bring gloves to the dissection hall. So this is one type of glove box which obviously will not maintain the sterility. Okay, it's a non-sterile one because the gloves will be exposed like this. So this is basically not to prevent this is just a barrier type of gloves, and these are sterile gloves. Okay, so we usually use these gloves in our operation theaters or to examine a patient. These gloves are used, but these gloves are basically so that no infection is transferred to the patients. Okay, no infection is transferred from our hands to the patients. But in dissection, there is no need for such things. So we usually use this type of gloves. Okay, here it is empty, this box is empty, but this type of glove box we use. These gloves are kept like a tissue, like tissues. So we pick up 1 or 2 gloves as per our need, and we can use them. And these are not sterile. So this is an expensive one. You don't need to buy these things. Last year, many of them bought this type of gloves, but that is a wastage of money. One glove set is 90 rupees. So if you touch the cadaver for 1 day, 90 rupees is gone. But this whole box is roughly 1300 rupees, but you will be getting 200 to 300 rupees like this. Like check in the store itself. So the whole box consists of roughly 100 gloves. Okay, 100 gloves. So 100 gloves set, that is 50 set of gloves. Or if you are using only one hand to see the structures only, you can use only one glove. But this single pair is 90 rupees. That's why I am just telling you. Now coming to the instrument parts. See, this is how a sterile gloves looks like. So in OT, what we do, we usually, here there is a tear mark is present here. Okay, see, tear down to open. So usually tear like this. Before that, we need to, what we do generally do in any OT theater, and you will also do during your internship also, we usually scrub our hand like this up to this part, and with like this we enter into the OT, and during doing assist, we tear the gloves like this. Then this part is completely sterile. Okay, no infection is present in this part, no pathogen is present in this part, and the whole OT is also infection free. Okay, so there are certain processes through which we make the OT like infection free, pathogen free. Although there can be some type of infection, but that is manageable. Those are nosocomial infections, hospital acquired infections. Those are there. But in most of the cases, the OT theaters obviously has to be made infection free. So we this is also sterile. We keep it like this. We bring out the gloves like this. See, this part is folded outwards. This is the inner part, but it is folded outwards. So the process is that you will take one gloves and put the hand inside like this, spread like this. See, like this. Your finger should be inside, okay? So that this part should not be touched by these fingers. That is the process. You should put one finger like this, and like this you have to pull it out like this, okay? Now this part is sterile, inside part is not sterile. This hand is also not sterile, okay? Now with this palm you will touch the finger part, okay, like this, because this part is sterile. Now with this finger part you will now try to enter the hand like this, and then you will pull it out like this, okay? So that is the whole process of wearing a gloves, and during that process 1 or 2 gloves will be wasted, that is for sure, okay? Because these gloves are fragile, okay, very much fragile. So, and most of the gloves are usually powdered inside, okay? Now let us see the structures. See, this is a scalpel. This is a scalpel blade. This is how it will be found in any store. You will found like this. What you will do, you will pull. This is a 24 size scalpel. We usually use the 22 or 24 size scalpel. There are other scalpel sizes also, size 15, size 11, then size 12. So size 11 is like this, like this. So it will be used for draining an abscess. Like suppose there is any furuncle or any boil, okay, a big boil, okay. So those things are not actually boil, those are carbuncle things. So those boils are punctured using this sharp needle. Let us forget this thing now. So we use the 24 size blade, okay. So we open the blade like this, okay. And after that, see, this is the BP handle I was talking about. This is your BP handle. It has a lock in the front. Okay, it has a lock in the front. You will take the needle like this. This part is very sharp. So if you are not like experienced to hold this type of needles, like these sharp needles, you will cut those hands. So take help. Okay, see, there is a lock here, and it also has a part to get attached. So you will do like this, push it, push, and it gets locked. So it gets locked. So now the needle will not come out. See, the needle will not come out, and you can use this needle to cut the structures. So this is a BP needle with a BP handle with a blade. Then it becomes the scalpel proper, okay. You can sterilize them, but these blades are not that much expensive, so you can just throw them, okay. So in any OT, these things are not necessary for dissection part. Just I am telling you the parts, like these instruments only. Please don't talk. Please don't talk. So these instruments, the same instruments are going to be used in OT also, okay. There will be like some bigger instruments also, but these are the basic instruments. That's why I am just telling you the same counterpart. So in OT, we cannot throw these things. So we will sterilize them using autoclave machine, fumigation machine. These machines are used, disinfectants are used. Yes. We can use them, but that will be not necessary. Now, these blades are very much cheap, 2, 3, 4 rupees like this only. So we can just replace them, okay. So now this is a mosquito forceps. This is a very small forceps. So we usually cut small structures with this forceps. And this is basically a episiotomy scissor, but we use it for cutting the structure. This is basically an episiotomy scissor, straight episiotomy scissor. So episiotomy scissors we use for what purpose? Anyone? Cutting the? Yes, tell. No, not yes. You can use to cut the placenta also, but that is basically to do an episiotomy operation, not operation procedure. Episiotomy is like during normal vaginal delivery, when the baby is coming out. Sometimes the vagina is not proper to accommodate the head of the baby. So we give a mediolateral cut like this, so that the vaginal wall enlarges and the baby can easily pulled out. Okay, so for this purpose we use an episiotomy scissor. Similarly, this is also a plain scissor, and these structures are used for cutting the ribs. So the ribs are hard structures, so we use this structure to cut the ribs. These are to pull certain structures. Suppose the skull bone, to pull it like this, we use these hard structures. So these are the basic instruments. What you will be needing? You will be needing one BP handle, one blade, and one of these scissors, plain scissors. Okay. This is a toothed forceps. Can you appreciate this teeth? This sharp. Okay. So these are tooth actually. So you can hold any structure with this, like this. Okay, you can hold them. So if you do like this, they will be easily punctured. You can easily hold them, but they will be easily punctured. Now this is a blunt forceps. So with this also you can hold, but they will not be punctured and they can easily slip out. So to hold the structure, for visualizing the structure, we can use this type of blunt forceps. Okay. So that's all almost, and from the instrument part. And this is a forceps we usually use to hold, to hold any substance. Suppose basically this is to hold your needle. So during suturing, we use this type of handle. What is the purpose? So it is basically needle holding forceps. See, there are certain serrations present here. So why needle holding forceps are needed in dissection also? Sometimes. Suppose we have opened a structure and we don't need it anymore to study, so we just can close them. Okay, so for that purpose. So that is seldom used. See, it has certain serrations. Okay, grooves. With this, we can easily hold a needle, and here there is a catch. This is a catch or lock. So if I hold a needle like this and use, the needle can easily slip out like this. Okay, so for that purpose, a catch has been given like this. See, now it is locked. It is locked. You cannot pull it apart. You cannot pull it apart. See, cannot pull it apart. How can you pull it apart? You have to do like this. Okay, again you do like this, it is attached. You cannot pull apart. So the needle is fixed here. Now if you do like this, it will come out. So that is a needle holding forceps. Okay, that's part from instrument. And these gloves are always disposed in any black dustbin. Okay. Sorry, red dustbin, okay, red dustbin. Why red dustbin? No, not. Basically, there is a formula. So basically, whenever, please listen, everyone. So for this, we have certain formulas. So red means rubber. So any substance you will see which is of rubber material, that we usually dispose in the red dustbin. Okay, and there are certain criteria for biomedical waste management also. So in biomedical waste management, let us go through them just once. So what are the substances we usually dispose in a yellow bin? Cytotoxins. Okay, cytotoxins. Then anatomical waste. PPE kit. Yes, there is a condition. PPE kit you can dispose if, please don't talk. PPE kit you can dispose if it is human waste stained, or else it comes in a rubber segment. Okay, there are certain controversial thing you will see in various books. Okay, because PPE kit also comes in rubber part also, right? So sometimes it can also be disposed in black one also. So there are certain controversial thing, but in book I think in yellow it is given, na? If it is given in yellow, the book you are following, you can follow that part. So there are certain controversial things, but in most of the cases for pathological is any human waste such as your vaccine, cytotoxic drugs, your contaminated bed sheets, then any like human waste containing bed sheets, then so these things you can dispose in a yellow bin. Any human waste, any human fecal material also, urine content also, these things you can dispose in a yellow bin. And in red, usually we dispose the rubber things such as catheter bag, okay, catheter tube mainly. So catheter, these things, then our gloves, these things we can dispose in red substance. Red means rubber. So any rubbery substance usually we dispose in a red box. Then in black, general waste such as food particles, food materials, these things we usually dispose in a black bin. In blue, we usually dispose what? Glass vials. These things we dispose in a blue one. In white, what? Sharp objects such as needles. Now suppose you have got a needle. Now in this needle, this is the sharp part, this part is sharp, this is the needle part. What is the name of this part? Syringe. Okay, so where will you dispose the syringe? Red. And the needle? White. Okay, fine. So you are acquainted with these things. Now if we study the upper limb part, we will be studying about this portion. Now in this portion we have three segments mainly. We have our forearm, arm, hand. Now in forearm, so this portion is our forearm. Okay, this is our forearm part. And this part is our hand. Okay. Sorry, arm. So forearm and arm. And this part is our hand, right? Now these things also has a anterior muscle group, posterior muscle group. Similarly, here also anterior muscle group and posterior muscle group. Okay. Now this anterior muscle group again subdivided into superficial muscle group, deep muscle group. Superficial muscle group, deep muscle group. Similarly, here also superficial muscle and deep muscle. Superficial muscle, deep muscle. Now again here these muscles have to be supplied by certain nerves. So we need to know about the nerve supply of those muscles also. Then blood supply. Now what are the nerves and the muscles? And here in the hand there are certain group of muscles. So this is a thinner muscle. These are thinner muscles. These are hypothinner muscles. Okay, thinner muscles, hypothinner muscles. Here we will see lumbricals. Here in these segments we will see lumbricals and interossei muscles. Okay, lumbricals and interossei muscles. So these things we will see one by one. Now in forearm, here we will see flexor carpi radialis muscle, flexor carpi ulnaris muscle, flexor digitorum superficialis muscle, then our pronator teres muscle, then we will also see brachioradialis muscle. These things, no, brachioradialis will be coming in the back of the arm. So these 4 or 5 muscles we will be seeing in the anterior part. Then if we go deeper, we will see again flexor carpi digitalis profundus, pronator quadratus. So here there is one muscle, that is pronator quadratus, and in the back of the forearm we will be again seeing extensor carpi radialis longus, extensor carpi radialis brevis, enconius, brachioradialis. So these are there are 7 or 8 muscle groups we will see in the back of the arm, which we need to memorize. Okay. Then in the front of the forearm, then in the front of the arm we will see biceps brachii, brachialis, this and coracobrachialis. These muscles we will see, and in the back of the arm we will see triceps brachii mainly. Okay. So now coming to these are the muscles that we are going to study. And in the hand, as I have already mentioned, the thinner and the hypothinner muscles. Then there are other muscles also, such as abductor longus brevis, then your abductor pollicis longus, then your extensor digiti minimi, these things you will see here. Okay. Now these are the upper limb muscles. Now what are the upper limb blood supply? So blood supply. So in short, if I need to tell you, so there is one artery, that is your subclavian artery. So below the clavicle, we have subclavian artery. That subclavian artery from here, it will carry on as your axillary artery. So first of all, there will be subclavian artery, then your axillary artery, then this will continue as your brachial artery. So you have to again know that this brachium, see, subclavian, as the name suggests, originates from below the clavicle. That is why subclavian. Then comes your axillary artery. So these artery will be present in your axilla part. Okay, axilla part. Which one is your axilla? The armpit part. Armpit is your axilla. Here will be your axillary artery. Then will come your brachial artery. So this brachial artery is derived from brachium. Brachium. And brachium is another name for your arm. So the second name of arm is brachium. So this brachial artery comes from, so the brachial artery will be present in your this portion. Now here there is one segment. Can you see this segment here where we flex our hand like this? So this segment is your cubital fossa. We will also study this part, cubital fossa. In this cubital fossa, the brachial artery that was coming like this, it gets divided. Okay, it gets divided into your radial artery and your ulnar artery. Then this radial artery and ulnar artery will give certain more branches and supply our whole hand. Okay, this is the artery supply. Similarly, there is venous supply in our body. So venous supply is important, but not from your exam point of view, but artery supply is usually asked, especially this brachial artery, radial artery and ulnar artery. So there are certain veins such as your median cubital vein, cephalic vein, bicipital vein. So these veins are there in your arm part like this, cephalic vein, then your bicipital vein, and here your median cubital vein. So we usually draw blood from this median cubital vein, which you can easily palpate here. Okay, you can easily see the median cubital vein here and also palpate here. So from here we draw the blood. Okay, so these things also we will try to see. Now coming to the nerve supply. So basically our arm is supplied by brachial plexus. Why I am telling these things to you? Because so that in dissection part you can easily, like whenever these terms are used, you can easily appreciate that these are the things to know. So brachial plexus. So this is a group of nerves. Now in brachial plexus we have certain types of parts. Okay, so here there are vertebra. These are cervical vertebra. From cervical vertebra, here you will see there is one foramen. Foramen means a hole. Foramen means hole. Through this foramen comes your foramen transverse cerium. Through this foramen transverse cerium comes your nerve supply from your brain. So these are your cervical plexus. From the cervical plexus, we get C2 to C8 and T1 structures. So C2, C3, C4, C5, C6, C7, C8 and T1. These structures we get from our cervical plexus. Okay. Now these structures together join and form. So these are the roots. So they form roots, then your trunks, divisions, cords. These things they form here. if you remember in my clavicle class, I told you about cervico-axillary canal. At that time, I told you that you will not understand that thing. So cervico-axillary canal. So through this canal, this nerve supply through our axilla will be supplied throughout our arm and forearm. Okay, that is your cervico-axillary canal. So this brachial plexus will be supplying our whole upper limb in both the sides. So there are two brachial plexus and they will be supplying our whole structures. So through this brachial plexus, we need to know all the structures for theory purpose. But in case of dissection, as we are starting with forearm, we need to know about axillary nerve that will be present in the axilla part. Then our median nerve, radial nerve. Radial nerve again divided into superficial and deep branch. Okay. Then comes your ulnar nerve. Again they are divided into our superficial and deep part. Then comes your interosseous nerve. So that's all. So these are the broad things that we need to know. Here also comes another nerve, that is your musculocutaneous nerve, which will be supplying our front of the arm, musculocutaneous nerve. Okay, so these things we need to have certain basic understanding. So now suppose we are starting with front of arm. Suppose so class is given front of arm. So what are the basic things we should be prepared before the class? First of all, I need to know about the muscles. In your textbook, you will get that all the muscles are given. What are the muscles? Our biceps brachii. So this is the biceps brachii muscle. If you cut this biceps brachii muscle and pull these structures, you will see at the base there is another muscle, that is your brachialis muscle. Okay, and there is these two muscles you will appreciate in this portion, and there is another muscle of the arm, front of arm, that is your coracobrachialis, coming like this, coracobrachialis. Okay, so these three muscles will be supplied by your musculocutaneous nerve. Okay, so these things you should know. Then you should also know, after knowing all these three muscles, you should know the origin and insertion of this muscle. That is, each of this muscle is originating from which part? Origin and insertion. So in your textbook you will see one box like this. After every topic there is one box where you will see here muscle groups are written, then origin is written, insertion is written, nerve supply, and then action. So far you know that this is flexion, this is extension, this is medial rotation, lateral rotation. Okay, so each of these muscles are designated for certain mechanism. So you need to know the mechanism of each and every muscle. So what are the major function of the front of the forearm? So this muscles has a function to pull the forearm towards the arm. So this is the arm, this is the forearm. So these muscles pull the forearm towards itself. So this is the function of the front of the arm muscles. Similarly, there are functions for back of the arm muscles. So these things you will find a chart, and you need to first of all memorize. After memorizing, then only you can appreciate this in your cadaver. So how to memorize? Not like just mugging them up. See those structures. In book also you will see those structures as schematic diagrams, and in dissection hall also you will see. So you will see that if these structures are present here, so they cannot be extended, so they will be needed to flex. So in this way you will memorize. At that time your bone helps, because if you know that here humerus is present, so if you have your own set of bones, if you have, but that is not a mandatory thing, so you can just draw the structures over the bone so that you can memorize before the exam. Okay, so and in your practical dissection manual also you need to make this box only. No need to write many things, just make this box. Suppose you are writing about the forearm muscles, so forearm muscles you need to just make two boxes. One is your superficial group of muscles, their function, action, nerve supply, origin, insertion, these things you need to mention, and your deep muscles group. So only 2 pages, and if possible, just draw them, okay, in your dissection manual. Similarly, your front of arm, back of arm, okay. So these are the things that we are going to see in our arm part and our forearm part. Now coming to cubital fossa. So here if you see, this is a depressed area, right? This is the depressed area. So this is known as our cubital fossa. This fossa is very much important. So here you will see 2 group of muscle. If you can appreciate, this is one muscle, okay, and this is another muscle. Similarly, here also another muscle present, here another muscle present, and there are certain nerves and vessels present here. We usually denote them as MBBS. Okay, MBBS. Why MBBS? Because from medial to lateral, these structures are present one by one. First of all comes your median nerve. No need to write these things, just see them. Median nerve. Then comes your bicipital tendon, BT. Then comes your brachial artery. Then comes your superficial branch of your radial nerve. Superficial branch of your radial nerve. So the radial nerve that I was talking about is present here at the superficial branch of our radial nerve. So these are the 4 structures. Whenever we will dissect this part, we will see them one by one. Okay. So how the median nerve is present, how the bicipital. See, if you do like this, you will see there is a hard structure in the fossa. You can appreciate it yourself. So you just extend your arm like this. You place one of your finger just in the middle, okay, and if you flex your arm like this, here is a hard structure you can appreciate, okay. Now medial to this hard structure will be your median nerve. So here is your median nerve, okay, and lateral to this will be your brachial artery. Why this is necessary? So in a live person you cannot like cut them and see those structures, you need to appreciate. So by palpating, there is one term known as palpation. By feeling these structures, you can appreciate the location of these structures. Okay. So this is the cubital fossa. Then will be your thorax part. So thorax, let us not discuss today. Just after upper limb, you will be oriented. Why I am taking this class? Just to orient you with the things that we are going to see. Usually this is not taken, but what happens now? So whenever students come, they just don't get used to the structures. So that you get yourself oriented to the structures before coming to the class, that what I am expecting from the class. So that's why I am just giving you this orientation. Now in upper limb it is gone. So in upper limb what we are going to see? So we are going to see arm, forearm. In arm we are going to see front and back of arm. In forearm we are going to see front and back of forearm. And then again we are going to see in the front as well as in the back 2 muscle group. One is your superficial muscle group, another one is your deep muscle group. Then we are going to see the nerve supply and we are going to see the blood supply. These are the things we are going to see. Then we will be seeing the cubital fossa and our hand part if possible. Hand is usually not shown because these structures are very much like not possible to appreciate. That's why we generally leave the hand part. Okay, so these are the things.